As the COVID-19 pandemic barrels across the countryside and continues to strike at the heart of communities, only privileged patients that can access an intensive care unit bed could have a chance of survival. There is great trepidation for those in the countryside's ailing hospitals who are writhing in the death throes as Uganda's hospitals creak under the strain of this deadly pandemic. The country's COVID-19 response in its early days received global plaudits when Uganda, whose health workforce has immense experience in dealing with pandemics, registered a few cases as the regime enforced stringent lockdown measures. But when the virus reached communities and has peaked during the elective season, it exposed the country's fragilities, a chronically underfunded health sector, a moribund health infrastructure, the gross gap between the haves and the have-nots, and what from the summary of a recent Finance Ministry report is a case of gross incompetence of the stewards who are supposed to combat the pandemic. With deaths in scores, which are not documented, especially in the countryside as millions can barely afford the cost to undertake a COVID test, the country's response appears to be lurching from one crisis to another. So how did things go wrong when Uganda appeared to be making strides in the fight against COVID-19 compared to neighboring states earlier on in the year?
Initially, we were doing very well. After some time, the message became monotonous. Remember the HIV, when people were scared, then they started changing behavior, and then the HIV went down. Then at one time, then it went up. Why? Because of complacency. So the complacency, but also the timing of political season, those two have been the major enemy.
Why did those in charge not rely on the lockdown as the saving grace to fully equip hospitals in time? A report issued last month by the Finance Ministry's Budgeting, Accountability and Monitoring Unit offers a blunt assessment of the response by various sectors. It provides a snapshot into the disjointed response, incompetent leadership, and poor planning within government's COVID-19 multi-sectoral approach to deal with the pandemic. According to the report, an astronomical 2.2 trillion shillings was doled out between March and the end of June to deal with the pandemic. Of this amount, 766.7 billion shillings was committed towards prevention of the pandemic and response interventions. The Health Ministry, which is at the forefront of combating the virus, is adversely mentioned in the report. The report details that by the end of June, the ministry had been given and spent at least 264 billion shillings from both government and donors, 119 billion shillings from government, 55 billion shillings pooled by government and World Bank's constituency emergency response component, 51 billion shillings from Islamic Development Bank, 28 billion shillings from Global Fund, and 10 billion shillings from Gavi, the Vaccine Alliance. Another 215 billion shillings was detailed as in the pipeline, including 89 billion shillings from government, 69 billion shillings from Global Fund, and 56 billion shillings pooled by both government and the World Bank's Uganda COVID-19 response and emergency preparedness project. But the Health Ministry's Permanent Secretary, Dr. Diana Atwine, described the report as unfortunate.
It is their report. They're entitled to have their report. But in relation to really some of the things they were raising, first of all, the manner, because these young ladies just came here, I'm told they interacted with the two officers who didn't even have much information. They phoned the external auditors. They are doing the work. They asked them the documents, they looked through, and they went away.
She told NTV that by the end of June, they had received only 119 billion shillings supplementary budget, complemented with off-budget commitments and expenditures by development partners.
When we asked for the money, it had to go through that process of supplementary. When did we get the supplementary? Didn't we get the supplementary at the end of May? Yeah. Meaning we had only 1 month to go. We had 1 month to close the financial year. And the implication is that the money you have not used, end of financial year it goes. What do? You are in the middle of that. You have signed. Actually, I had to go to PPD. I say, look, I am procuring these things, all I want to do direct procurement.
Atwine also said the ministry has been judged harshly.
There was so much pressure. Let me tell you, we have had so much pressure and we have been blamed, everybody other than themselves, for being careful. Somehow they blame the Ministry of Health. So we have been the punch bag for COVID.
In the report, the ministry undertook procurement of 38 ambulances at 11 billion shillings through MS City Ambulance Limited, a company registered in 2012. According to the company registration documents, its shareholders are Hannington Byarugaba, Nabela Birungi Byarugaba and Jamil Muhammad. The report claims that the initial delivery date was meant to be 30th July 2020. However, by September, no ambulance had been delivered and the fulfillment of the contract was extended to last month. Another firm, MS Elsmid East African Limited, was contracted on 18th June 2020 to supply equipment worth 26 billion shillings. Initial deliveries were expected in August 2020. However, ostensibly due to the high demand of the same equipment across the world, the delivery period was extended to December 2020. The supplier was expected to provide 1,553 units of equipment to 17 regional referral hospitals, and they included defibrillators, suction and fusion pumps, nebulizers, mobile X-rays, oxygen concentrators, weighing scales, portable ultrasounds, patient trolleys, ventilators, ICU beds, among others. A second contract executed and worth 10.5 billion shillings with joint medical stores to procure 388 intensive care unit or ICU equipment was signed on May 20th, 2020. The equipment was to be delivered in the first 6 weeks, but the firm had failed to meet the terms of the contract, and by December 2020, joint medical stores had delivered equipment to only 6 hospitals: Nagoro, Entebbe, Jinja, Mbale, Lacho and Lira. The delivery and installation of this equipment in hospitals is expected to be completed by end of December 2020, but there is a snowball's chance in hell that the contractor will meet the deadline. Some hospitals, it was observed in the report, like Gulu and Arua, do not have enough space to accommodate the ICU equipment. Another 2.9 billion shillings contract for megaphones to ease communication of COVID-19 message within the parishes and sub-counties was signed on May 11th. The report details that 108,863 megaphones were procured at a unit cost of 230,000 shillings and 43,450 pieces of dry cells at 10,000 shillings each. The megaphones were delivered on June 22nd. However, Oyam, Omoro, Apach, Agago, Gomba and Butambala districts, among others, visited by the monitoring team in July, August up to September, had not received these items, the report notes. The ministry further contracted MS Silverbacks Pharmacy Limited to supply and install 450 oxygen cylinders, including regulators, humidifier bottles and cannulas at Mulago and Entebbe hospitals at a cost of 6.4 billion shillings. Company registration documents drawn by Sam Kutesa and company advocates show the company is registered in the names of Charlotte Kainerugaba and Ishta Asimwe, both daughters of Foreign Affairs Minister. The contract was signed on May 6th, providing a 2-year warranty including spare parts, according to the report. Although 100% of the invoice had been paid by June, deliveries and installations had not commenced by September. Notably, the same supplier, MS Silverbacks Pharmacy, installed oxygen plants in 13 regional referral hospitals at the same cost 3 years ago for the financial year 2016-2017. However, variations in capacity were noted, with the contractor providing 2 plants with a capacity of approximately 5 plants, the report reads in part.
That pharmacy, that agency, although the owners are the children of Mr. Kutesa, these ladies also, I think, are Ugandans. They're entitled to do business. That is number one. But also number two, these are people who had been supplying government oxygen plant because they are the sole representative of the manufacturer in Uganda. and they're the ones that have been supplying all oxygen plants in our country. They are the ones that service all our plants. They did that before I came here.
3.8 billion shillings was spent on procuring sleeper tents, with each of the 100 capacity tents procured at 163 million shillings, and although the contract stipulated 20 tents, only 13 were delivered and installed at Nambole by the time of monitoring in September 2020. All the tents were reportedly blown by the wind upon a heavy storm, since they could not be supported by the stadium turf, the finance report noted.
Initially, our plan was to have more tents in Nambole, in the open there. And when they were going to fix them, the Nambole authority stopped them, said, this stuff is very expensive. If you puncture it in the process of setting up, we are going to have trouble replacing it. Don't. So they had to pull everything and put there, waiting to be transported to the regional referrals.
Another 4 billion shillings was transferred to 16 regional referral hospitals for COVID-19 case management, with each hospital receiving 270 million shillings, but the report detailed inefficiency in utilization of COVID-19 funds by referral hospitals, characterized by varying unit costs. The report further raises a red flag on payments to hotels and quarantine centers which housed returnees. Atwine said finding hotels willing to take on suspected COVID-19 patients was hard, but either way, Cabinet assigned the responsibility to a specific minister.
Planes were powering people at the airport, and we are saying institutional quarantine. So the Minister for Tourism, Mr. Chiwanda, was instructed by Cabinet to identify hotels that were willing to take up these people. Remember that time the stigma that was attached. So Mr. Chiwanda tried to contact different hotels and he would give us the names.
Contracts worth 3.9 billion shillings was signed in May 2020 with various service providers to provide personal protective equipment. One company, N2M Company Limited, delivered 3,200 surgical masks, each packet containing 50 masks at 247,343 shillings, translating into 4,946 shillings per mask in March 2020. But the report says that there were no witnesses to the contract signed, while some of the other deliveries were substandard.
If really those things were substandard, wouldn't we have had 100% of our health workers in Mulago sick? When people are working there from the time we started admitting in Nambole, in NTV, in ICU, not a single person has been affected. So then how come, if they were using substandard, how come they are not infected? Don't you need to ask that question? I do. So I think whoever is doing that is just making a malicious statement, because as far as I know, we procured standard things. And in any case, they are not the regulators. The regulators who have the machines to test, they passed these masks.
The Auditor General is currently undertaking a detailed audit of all COVID-19 expenditure, but even then, it may not provide a complete picture of the hemorrhage. For instance, as regards food distribution, the report details that beneficiaries received ratios of 6 kilograms of maize flour per person and not 10 kilograms, 3 kilograms of beans per person, and salt. The lactating mothers and the sick received 2 kilograms of powdered milk and 2 kilograms of sugar. The beneficiaries, at least 683,131 households in Kampala, Wakiso and Mukono, inclusive of 15,242 households and 22,521 persons served by Uganda Red Cross Society donations in Seta, Ward Goma, Mukono, received food items worth 11 million kilograms of maize flour, 1.2 million kilograms of beans, 26,221 tins of milk, and 50,448 kilograms of sugar.
Dealing with the vulnerable people in Kampala.
The report, however, indicates that the Office of the Prime Minister failed to provide detailed breakdown expenditure for the food procurement.
Within the next.
The report further notes the majority of vulnerable households did not benefit from the food donations, including many urban and rural dwellers, including the sick and persons with disabilities.
We are test running this exercise.
The Office of the Prime Minister also spent 1.8 billion shillings on procurement of agricultural items, but they did not avail the procurement expenditure to meet the value for money audit. The closure of schools on March 18th directly impacted 73,240 institutions, pre-primary to higher, and affected some 15 million learners and 548,128 teachers. In response, the Education Ministry formulated a COVID-19 preparedness plan to ensure effective interventions from the ministry level to the 146 district local governments, including formulation of a national education task force for COVID-19. The Education Task Force secured a 73 billion shillings grant from the World Bank to, among others, secure students' learning during the school closures with the provision of self-studying home packages and use of radio and television to deliver lessons, safe reopening of schools and re-entry of students through school grants and funds for hand-washing facilities. The study materials, the report notes, were delivered and distributed. However, the intervention was affected by concerns relating to adequacy, effectiveness and the mode of distribution. Specifically, it was noted that over 50% of the sub-counties received as few as 3 copies of study materials for all their schools, and the ministry is in debt of 1.3 billion shillings to about 38 radio stations and the teachers who taught the lessons, and owes another 6 billion shillings to New Vision for printing and distribution of the study materials. According to Julius Kapwepwe, the director of programs at Uganda Debt Network, Ugandans have a right to suspect mischief when it comes to government and money.
For instance, in the financial year that has just ended into the current one, over 14 loans have been acquired by government in the name of COVID interventions. And at least 6 supplementary budgets were passed in the name of COVID. We remain concerned that in addition to that, Ugandans, individuals and companies made contributions in kind and even in financial terms. How much of that money has been used and where is it?
He said several agencies were allocated money as a justification for the supplementary budget.
If you interrogated the process of supplementary budgets, including one of them that was just passed 3 days to end of the financial year, you can imagine. I think Ugandans have reason to think mischief, to be suspicious of the process, to the extent that even members of parliament themselves, in the process of passing some of the supplementary budgets, included their something in billions of shillings, to the extent of about 900 billion, close to 1 trillion shillings. How much of that money has been used where is simply what Ugandans are asking. And I think it is imprudent for the National COVID Task Force, for Cabinet, for Ministry of Health and other ministries to simply keep mum about what has happened ever since we gave them these loads of money.
Earlier on, Parliament passed supplementary budgets and 14 loan requests for the executive to ramp up the multi-sectoral response to combat the pandemic. 2 weeks into the lockdown, government announced food relief distribution to 1.5 million urban poor and other vulnerable groups around Kampala, Wakiso and Mukono districts. Before the food distribution had commenced, the State House Anti-Corruption Unit arrested 4 senior OPM officials for allegedly inflating prices for relief food by 4 billion shillings. shillings. The Speaker of Parliament, Rebecca Kadaga, fell out with the executive in the days that followed after she led MPs to allocate themselves 10 billion shillings from the health supplementary budget when she blew the whistle that OPM was distributing rotten food.
I don't know why you are fixated on the 10 billion. I want to read to you what was passed in the supplementary, and you'll find that includes you people as well. So this is that supplementary of 383. The allotments were as follows: Office of the President, East and North District Secretariat, 15 billion. You have got that? Office of the Prime Minister, support to vulnerable persons, 59 billion. That's the one which is buying the expired milk. You are aware that milk is expired, which are serving Ugandans. And the beans, the rotten beans.
The International Monetary Fund and the World Bank, which have provided much-needed budget support to combat the COVID-19 pandemic, put in place tough accountability conditions, including full disclosure of how sectors procured and spent the funds. Uganda has a long history of graft in times of crisis, including billions of shillings stolen by OPM and other government officials, meant to rehabilitate the war-ravaged northern Uganda. If government wants to combat the scourge of graft, it must set the toughest penalty for those who steal funds meant for the most vulnerable communities.